Modern laboratory tests for the diagnosis and screening of tuberculosis (TB) have significantly advanced in recent years, providing more accurate and efficient means of detecting the presence of Mycobacterium tuberculosis, the bacterium that causes TB. Here are some key laboratory tests used for TB diagnosis and screening. Molecular tests. 1. Polymerase chain reaction (PCR). PCR amplifies and detects specific DNA sequences of M. Tuberculosis. It is highly sensitive and allows for rapid identification of the bacterium. 2. GenExpert ME-TB or RIF test. This is a rapid molecular test that simultaneously detects M. tuberculosis and assesses rifampicin resistance. It provides results within a few hours and is particularly useful in diagnosing TB in individuals with HIV. 3. Culturetists, liquid culture, culturing M. Tuberculosis in liquid media allows for faster growth and detection to traditional solid cultures. Solid culture, culturing on solid media like Lowenstein-Jensen-Agar, remains a standard method for confirming TB and testing for drug susceptibility. 4. Serological tests, TB rapid test. While not as commonly used as molecular or culture-based tests, serological tests detect antibodies against M. tuberculosis. However, their sensitivity and specificity can vary, and they are not recommended as standalone diagnostic tools. 5. Interferon gamma release assays, IGRAs, such as the QuantiFERON TB Gold test, measure the release of interferon gamma by T cells in response to M. tuberculosis antigens. These tests help determine whether a person has been exposed to TB. 6. Molecular line probe assays, assays, like the genotype ME-TDR+, can detect drug resistance mutations in M. tuberculosis, providing information about the susceptibility of the strain to certain anti-TB drugs. 7. Urine lipoarabinomen and LAM test. This point-of-care test detects the presence of LAM, a component of the M. tuberculosis cell wall, in urine. It is particularly useful in diagnosing TB in HIV-positive individuals. In conclusion, it's important to note that a combination of tests is often used to increase the accuracy of TB diagnosis. Additionally, the choice of tests may depend on factors such as the patient's clinical presentation, risk factors, and available resources in the healthcare setting. Regular updates in diagnostic technologies may lead to the introduction of new methods in the future.